The irony of a heaven-sent Texas sunrise is that it happens so fast you barely notice it. Yet if you catch it, you'll never forget the sight. The landscape of Texas healthcare is changing just as quickly. Like the breathtaking Texas sunrise, a new day in healthcare has emerged. One that through quiet transformation now is truly focused on society's most enduring responsibility, caring for each other.
Well, I think in the past, what we've done is we've kind of created what we think was best for us, not so much what's best for the patient. We've heard reports that there's as much as maybe 30% waste in the healthcare field today, and how do we eliminate that?
The way we've been doing it hasn't worked. Cost goes up every year, way too much, and it's unsustainable.
But imagine a healthcare system motivated not by simply caring for the sick, but motivated to provide real health care, personalized to each patient, and maintaining the wellness of an entire population.
For the last year, we've been pulling Baylor, Scott & White together. Now we're positioned to take Baylor, Scott & White as one and push this to the frontiers of healthcare and change healthcare at the level of the person that matters, which are the people in our communities.
Personalized quality care is a century-long tradition in Central Texas. It is the Scott & White legacy. Daniel Mundine is celebrating his 17th birthday at McLean Children's Hospital in Temple. 3 diseases are benching his promising soccer career.
I started playing soccer when I was about 4 years old, actually, and I played like every year. This is the first year I haven't been able to play at all because I've been too sick, so that's been kind of hard.
Hey, Daniel. How are you, buddy?
Dr. Ashish Barad is the pediatric gastroenterologist managing the teen's care.
You feeling a little better than this morning?
And what's really hard as a physician to treat him is some of those complaints or symptoms can overlap as far as what condition can be causing it. And that's been the real medical dilemma with him. Obviously, we're still on the journey.
If everything that goes well and we get you off the pain medicines, we're gonna get everything situated for you to go home.
I myself have a hard time with a patient like Daniel because I love taking care of people. All of us want to see a patient, do something for that patient. Next time they come in, they say, "Hey doc, you fixed me, I'm all better, thanks."
Mundine's future is uncertain, but he and his mother remain positive, largely on the confidence imbued by Dr. Barad and the quality care that's brought recognition to the Scott & White brand on a national level.
It was like we were floating in the ocean, and Dr. Barad was the one that pulled us out, you know, because we didn't know what was going on. He's been in 7 different children's hospitals. This doesn't feel that way. He's gonna be okay, and I know that it's gonna be done in the best way for him.
In Dallas-Fort Worth, Baylor is recognized for centers of excellence built by pioneers like Dr. Joran Klintmalm. In December 1984, he performed the first liver transplant in the Southwest.
I get this phone call. We have this little girl, 5 years old, that needs that transplant. This was a highly public thing to do, and with very high stakes. And said, we'll do it.
3 decades later, Dr. Klintmalm continues his work as a pioneer, building a biorepository unlike anything in the world.
We had like 35,000 samples, and we have, with all this richness of data we can actually define. I can pull out the sample on a patient 15 years after the transplant, and I can actually define exactly in detail what that patient, that sample has gone through during those 15 years. Every rejection, every infection, all the medications, everything. So it's really an incredible, it's a national resource, frankly. No one else has it.
Here we go, see what happens.
One of the newest surgeons at Baylor Scott & White is Dr. Gonzalo Gonzalez Stowinski. He is the director of a heart transplantation program becoming a national center of excellence.
Danny, what's the blood type?
In 2 years, his unit has performed over 150 heart transplants, second most of any facility nationwide. Patients who earn a place on his waiting list don't stay there long.
So what are the average waits now here in your program?
Today, ours is still running about a mean of 7 days.
That's incredible.
It is incredible.
Surgically, I don't think it's a problem. Medically, it's the challenge. We do a number of evaluations to make sure that the patient's a good candidate. If he doesn't feel his feet, if he's got a non-healing ulcer, that's bad peripheral vasculopathy. The case gets presented to a transplant selection committee, and that's composed of about 20 individuals that review the case and give their opinions as to whether the patient would be a good candidate to be transplanted or not.
For what's happening inside of him, this is the kind of person to consider it in.
Our outcomes are superb. They're probably some of the best in the nation. We do want a transplant. We're very serious about it, and when you are on our list, we will transplant you.
Hello?
Hello, Mr. Gutierrez?
Dr. Gonzalez? Yes, hello, I'm Doris Gutierrez.
Okay, well listen, I'm calling you to give you some good news.
You're gonna get a heart transplant today.
Today?
Yes!
Oh my God. Thank you. Thanks for calling me.
You're welcome. Bye-bye. That's pretty cool.
In September 2014, Dr. Gonzalez's team harvested a heart for 49-year-old Doris Gutierrez, who'd been on the wait list just a few weeks when a high-risk heart became available nearly 800 miles away. Dr. Gonzalez put his transplantation team into action. Four hours after harvesting the organ, it was beating again.
Gonzo joined us from the Cleveland Clinic a couple of years ago, and he has just done a wonderful job of expanding the heart transplant program. Only Cedars-Sinai in Los Angeles is busier, and we're closing on him rapidly.
I want Baylor to be the best in the world with cardiovascular services. 5-10 years from now, we will have the premier cardiovascular program in the world. That's what I'm going for.
Baylor Scott & White is already going for it in research, awarded more than $26.5 million in grants in fiscal year 2014 alone. There are over 2,000 active and ongoing clinical studies underway here, a priority established a generation ago to bring patients the latest clinically based research.
The Baylor Research Institute was put together in 1984 by a group of clinicians who had an interest in promoting their specialty. We've got world-class clinicians, and we've got world-class clinicians doing the clinical trials that the world-class scientists are putting together. This is a combination that I think is actually very unique.
Inside laboratories at Baylor Scott & White, some of the best minds in medicine are developing new cancer-fighting drugs. Gerard Jarosky is developing a vaccine for head and neck cancers in Dallas. One day it could be manufactured in Temple.
The moment we heard whispers of the merger between Baylor and Scott & White, that was exactly around the time when we were thinking of how we were going to move our vaccines from the laboratory into people, and we heard about the Scott & White facility in Temple, and we're doing some pretty exciting things collaboratively with them. We think that this is one of the reasons why the merger happened, to bring people together into a family.
Also trending at the Baylor Institute for Immunology Research is Dr. Virginia Pasquale, who's discovered a treatment for children with systemic onset juvenile arthritis.
These are children with swollen joints, many of them in wheelchairs. The only treatment we've had for them has been steroids, which really just dampens it down. It doesn't really do anything to affect the disease. We found the target. It was an inflammatory cytokine, and we found the blocker. We give it to these children, 4 days, they're better.
We are not developing new drugs. We are trying to understand the cause and the mediators, because there might be available drugs out there that we can use to control the symptoms of these patients. This is exactly what we did in the case of systemic onset juvenile arthritis. We understood what was causing the inflammation. There was an available drug. We used this drug in the patients and it worked.
Dr. Pasquale is following this breakthrough, using the microRNA platform to identify other targets of autoimmune disease, including lupus. Today, the Institute is a lupus center of excellence, known for translating basic science into patient care around the world. What makes great care possible? On the southern edge of Waco, Baylor Scott & White Hillcrest Medical Center glistens with a new day. The hospital was renamed in June 2014, the first to don the Baylor Scott & White name. It is the physical embodiment of one of the largest not-for-profit health systems in the country. The merger of two recognized healthcare leaders is about much more than their 49 hospitals, 800 access points, nearly 6,000 physicians, and 35,000 employees. It is about establishing an organization with a strength and scope to bring to life a better future for healthcare in Texas and beyond.
Obviously, population health management is a big part of our strategy. It's what really drew Baylor and Scott & White together, because we both have a vision around meeting the needs of our communities, individuals. It's really fulfilling the triple aim. It's really improving the patient experience for the patient, to have a much broader and more patient-focused experience. It's about meeting the needs of the communities and improving the overall health of the population you're serving. And then ultimately, how do you continue to improve quality while reducing cost?
This is a big deal for healthcare, and as a patient of either one of the two systems, I think it's going to provide the highest quality of medical care, and just as importantly, to provide that health care at the lowest possible cost.
The uniqueness of this system is not just going to be a regional hospital in Texas. It's going to be one of the premier hospital systems in America and in the world.
The great thing about Baylor Scott & White is that we are the future. We're living on the edge of where healthcare needs to go, and we're leading national healthcare.
Together, the future Baylor Scott & White envisioned will be one founded on a strategy of population health.
We have heard a lot about accountable care organizations and what's called population health. So for example, myself as a heart surgeon within Baylor, my job won't be to just do a bypass operation on a patient that happens to be diabetic, but it'll be part of a continuum of care to be able to manage all aspects of that patient's diabetes, for the next 20 years.
Supporting Baylor Scott & White's capacity to deliver this new model is the award-winning Scott & White Health Plan. It makes affordable access possible to more than 200,000 Texans. The benefit of the insurer and healthcare provider being one is a shared investment in keeping Texans healthy.
For the last 2 years, we've been ranked the #1 plan in Texas. Not only in Texas, but you would have to go to California or Florida to find a more highly ranked plan.
This is clearly the best product out there in the Dallas-Fort Worth area, hands down.
When we were looking at how are we going to have the Scott & White Health Plan come through the whole of Scott & White and Baylor together, we realized that we had the Baylor Quality Alliance as a care management structure, together with the health plan, which is a care financing structure. This is just wonderful for the care of patients.
We'll take on financial responsibility for the health of a community, and through the use of our excellent care protocols and hopefully with the addition of good analytics, we can intervene and keep that population healthy.
We're defining a higher value proposition for Baylor Scott & White that says, if I'm a patient in Baylor Scott & White, what will be different? What will be better?
For one, the Baylor Scott & White Quality Alliance. It was formed to integrate employed and independent physicians and hospitals for the purpose of improving the value of care by following data-driven practices that will lower cost while providing more quality and coordinated care. Improving the overall health of a population means a paradigm shift where keeping people healthy is paramount.
We're very good at stroke care, but the reality is reaching out to a population and knowing who has uncontrolled hypertension is going to prevent many, many strokes. And that will definitely not only improve the health of those people, but reduce their future costs. It represents in many ways a mind shift for both hospitals and doctors. Today, healthcare is basically financed by getting paid for each thing we do. And so new payment methods will emerge that align incentives between patients, doctors, and payers better. Baylor Scott & White Quality Alliance will be focused on trying to avoid those unnecessary wastes, which are very, very prevalent in healthcare today.
Avoiding waste and increasing patient satisfaction can be done through the Patient-Centered Medical Home Comprehensive Care Team. The Quality Alliance is using this team approach and coordinating care more efficiently with help from registered nurse care managers and health coordinators.
These nurses' jobs is to reach out to our sickest patients. They're available to help them understand their disease, to teach them, to reconcile their medications, to coordinate their care between specialists and visits, and to be available to this patient to prevent unnecessary trips to the emergency room.
We're not going to be paid for what we do, we're going to be paid for the outcomes. I don't know that there's many other industries in the world where you get paid for effort. You usually get paid for results. But in healthcare, that's very, very complicated. So to me, that's a big component of population health.
One of the keys to unlocking the future of healthcare is information technology. Baylor Scott & White Health is becoming united on the leading medical record-keeping system in the industry. Implementation of this system was recently completed throughout the Central Division.
The documentation that we have now for a patient, it's incredible. When you have an integrated system like Baylor Scott & White wants to be, you need a single integrated patient record.
Using some of the top software designers in the industry, Baylor Scott & White is creating programs to provide personalized health and wellness with features like voluntary appointment reminders sent straight to your desktop. The ultimate goal is to extend quality care and provide information the way each patient needs it. 10 days after the electronic medical record implementation at Baylor Scott & White Hillcrest Medical Center, a collision near Waco took the life of one child and severely injured 3 others. With this electronic medical record in place, nurses were able to stand ready at the operating room at McLean Children's Hospital while triage continued at Hillcrest. Medical teams in both hospitals monitored the patient's vital signs and treatment en route to surgery. Barely out of the box, and this new technology is saving seconds of precious time in order to save lives.
Okay, I've noticed that we've had an overall change.
Just as a single patient record is more easily shared across providers, so is an identified best practice. Staff collaboration on lean process improvement eliminates waste and allows teams to maximize their effectiveness, raising patients' and employee satisfaction with the care provided. Best practices, as well as ideas for improvement, are being shared every day across this expansive system.
We get people into huddles. We start with one metric, let's say it's safety. And we look at the metrics of where we are and where we need to be. We pick one goal, and the boss may say something like, we've made good progress towards this goal, but we're not there. What could we try today? As we do our job, you see, this isn't going to take 1 minute away from work. What could we try today? We're hoping that every single individual brings an idea forward to implement every day, and we're after 100% of our employees. This is not a training of a select group of people, and it's not a single demonstration project. Every person, every day.
We want nurses that care for patients the way we would want our loved ones cared for.
Okay, well, we can just take a look.
So we have stressed excellence in nursing. We look at specific quality metrics for patients. We've driven down infection rates significantly over the last several years. So we benchmark ourselves against hospitals nationally and magnet hospitals nationally. And our goal is to exceed those national benchmarks. And we pretty well exceed those benchmarks every year.
Nurses who give chemotherapy treatments and who work with cancer patients become certified. You have to have at least 25% of your nurses certified. We have 77% of them certified here in Temple, which is a remarkable number.
Also remarkable is Baylor Scott & White's nationally recognized commitment to quality. The organization is on a never-ending quest for improved quality by examining the care we provide every day and the outcomes of that care. The beneficiary, the patient.
The Steep Global Institute really evolved out of Joel Allison's commitment to have Baylor Scott & White Health be one of the most trusted sources of healthcare anywhere in the world. We have the historic Baylor healthcare system, but really evolved out of a hospital administration model, the medical group practice model of Scott & White, bringing together the best of those two approaches to improve the care for the communities we serve.
The goal is to see that together we can improve the health of the population in a community, that we can help not only improve quality but lower cost and be more cost effective so that people have access to safe, quality, compassionate care.
Increasing access to care requires training more caregivers. Baylor Scott & White is committed to addressing the statewide physician shortage, as well as training students to build a team of skilled clinical professionals.
The first internship training program for physicians was started here in Texas, so we are the pioneers in Texas. If you go back to the original mission of the institution, education and training was part and parcel of the mission, which continues to be in today's larger Baylor Scott & White Health. And today, we have 37 accredited residencies and fellowships with 440 medical residents trained every year through Baylor Scott & White Health and the Central Division.
We try to create an environment where people are always learning. We provide thousands of hours of education every year to our staff. We actually, in terms of clinical rotations for students to come into Baylor and learn, will be between 400,000 and 500,000 hours of clinical rotations this last year.
Continuous improvement is at the core of everything Baylor Scott & White does, while never losing sight of its mission. That may mean going door to door in communities to seek out patients who do not have access to health care. 9 community care clinics like this one in a church in Plano provide a compassionate medical home for underserved patients.
I don't have transportation, I don't drive, I don't have a car. And here, they take good care of me. And the doctors give me medicine, and I'm grateful for you.
Having Baylor here in this community has drastically changed this community for the better. There are individuals in this community who have never been able to receive health care, and because of Baylor's support, many of the individuals here have seen their first doctor in almost 20, maybe even 30 years.
Obesity. It is one of our greatest health issues and a major contributor to the over 29 million people in the U.S. with diabetes. Being overweight can lead to heart failure, blindness, amputations, and quiet and active life. Classes like these in southern Dallas are another example of Baylor Scott & White extending population health by reaching deep into the most at-risk communities. The area where this Diabetes Health and Wellness Institute is located not only has the highest risk for chronic disease in Dallas County, but also struggles with poverty and access to resources to improve their health.
One of the components of prevention is being physically active, and what we try to do is not just educate on what to do as far as maintaining a healthy lifestyle, but giving them a place where they can practice it. All right, guys, that's class for today.
Great programs, outstanding technology, and the world's finest physicians are still only part of the Baylor Scott & White story. Chris Coleman's family thought he'd died several times following a life-saving liver transplant in 2014.
I thought that we've lost him at least 6 times. He is truly just a walking, talking miracle.
In these situations, families rely on the organization's Christian ministry of healing. It is in moments like this that many experience the most profound revelations in their human relationships.
So many people I've met who said, whether or not God caused this, God knew how to help me make this into the deepest experience of my life.
We call those miracles.
Amen. Yes, yes. And the miracle is not escaping death. The miracle is understanding what God wants us to be in the face of our human limitations.
I honestly don't know how I could have gone through it where I could not have expressed my faith. That's what gives you hope. And without hope, there's nothing.
To provide hope and extend health, Baylor Scott & White is moving forward with plans to build the finest healthcare system in the world.
But when you take two great institutions that think so similarly, that have the same mission, and put them together, these two organizations are going to be able to do so much to change medicine that I think our opportunities are endless.
Both organizations are over a century old. Our physicians have been working together for years for the benefit of large groups of patients, to keep them healthy, to get them better when they're not healthy, to be a partner in their health throughout their entire life.
Regardless of how big we get, we never lose sight of the fact that what our mission is, why we are here, is take care of patients. I mean, we don't have public shareholders. The communities of patients we serve are the shareholders. Our board of trustees serve as volunteers holding the assets of all these facilities in trust for those communities.
Both Baylor Healthcare in Dallas, Scott & White in Temple were found on Christian principles of healing. So you put the two together and you had the same values. It'll be by far the largest healthcare system in Texas and in the Southwest, and that's going to be most unique. And I just think the best is yet to come.